Hello, today we're presenting the responses to the COVID-19 pandemic in New York City, Los Angeles, and Houston. And our PowerPoint today is presented by Justine Suarez, Noir Sen, Kevin Wong, and Jianmei Wu. Our goal is to present the responses of New York City, New York, Los Angeles, California, and Houston, Texas. Each of these cities represent unique timelines, communities, and public policies. Each city's response was analyzed for timeliness of response, public policies created, and how receptive each community was to the implementation of these policies. Their effective or ineffectiveness ought to be reflected in case numbers and mortality rates, timelines for reopening procedures, and where each city stands today. The emergence of a new or novel coronavirus in the later months of 2019 truly shook up the world. What was initially suspected as some sort of viral pneumonia in hospitalized patients in Wuhan, China, quickly became confirmed as a new virus particle of the coronavirus family, to be later named SARS-CoV-2 or COVID-19. People with COVID-19 have a wide range of reported symptoms, from mild to severe illness. The transmission of this virus is thought to be person to person, mainly through respiratory droplets expelled from an infected person during a cough, sneeze, or simply talking. Due to the relatively easy modes of transmission, the response to this virus was immense and widespread. With this disease came an added risk of mortality for older adults and people who have underlying medical conditions such as heart or lung disease, diabetes, and/or other immune-suppressing conditions. The CDC and the Department of Homeland Security implemented health screenings in an attempt to identify ill passengers flying to the United States from Wuhan, China, in San Francisco, New York, and Los Angeles airports on January 17, 2020. The first case of COVID-19 in the United States was reported on January 19, 2020, in the northwestern corner of Washington State, and was confirmed to have been imported from China. The U.S. federal government declared a public health emergency on January 27, 2020, in response to the COVID-19 pandemic. By January 30, 2020, the World Health Organization, WHO, had declared this novel coronavirus outbreak a global health emergency. On Wednesday, February 26, 2020, Dr. Nancy Messonnier, Director of the Center of Disease Control, or CDC's National Center for Immunization and Respiratory Diseases, gave an update stating that the, quote, outbreak is inevitable and may lead to severe disruption of everyday life, as well as saying, now is the time for businesses, hospitals, communities, schools, and everyday people to begin preparing for significant disruption of our lives, end quote. Finally, on March 16, 2020, President Trump announced social distancing guidelines to be in place for 2 weeks. On March 18, 2020, President Trump signed an executive order allowing for the use of the Defense Production Act. This would entice manufacturing companies to focus on producing crucial medical supplies as the demand increased across the country. On March 19, 2020, the CDC issued updated guidelines instructing medical professionals to use homemade masks, such as a bandana or scarf, for care of COVID-19 patients as a last resort, if proper personal protective equipment, or PPE, were not available, despite the blaring fact that these homemade masks were not tested for their capability to protect the person wearing them. That same day, President Trump stated during a White House press briefing that the responsibility of supplying PPE to medical professionals lies with state governors, not the federal government. President Trump stated, quote, governors are supposed to be doing a lot of this work, and they are doing a lot of this work. The federal government is not supposed to be out there buying vast amounts of items and then shipping. You know, we're not a shipping clerk. Within days, state governors began to lock down their individual states, beginning March 19th in California and rippling across the country. Through the end of March 2020, hospitals reported facing severe shortages of testing supplies, widespread shortages of PPE, difficulty maintaining adequate staff, and overall shortages of critical supplies. In some cases, PPE that the federal government provided to hospitals was expired or dry rotted. This lack of supplies was parallel with the lack of testing kits, specimen collection equipment, and PPE for the medical professionals that were available to perform these collections and tests. There was a strong disconnect between medical supply demand, including ventilators, and the belief, response, and action of the federal government to provide sufficient aid to these affected states.
Thank you, Justine. So my name is Noor Hessen, and I'll be doing New York City, and I will be analyzing New York City's COVID-19 response. So just to summarize what New York is the largest city in the United States. We'll be looking at the boroughs that make up New York. As you can see on the map, we have Brooklyn, Bronx, Manhattan, Queens, Staten Island, and it was the home of the epicenter of the COVID-19 pandemic in the United States. Many would remember that in March, sort of all the different state legislatures were watching how affected New York City was with COVID-19, and a lot were taking notes and analyzing to see what they were doing in active response to the pandemic. And there was a lot of eyes and attention on New York at the time. So in this presentation, I'll be analyzing both state policies enacted by New York Governor Andrew Cuomo, as well as New York City Council and Mayor Bill de Blasio. And we'll be looking at those policies and their effectiveness at controlling the COVID-19 pandemic. So I call this one March Madness because this was kind of the beginning stages. March 1st actually marked the first confirmed case of COVID-19 in New York. And then on March 7th, Governor Cuomo issued a official state of emergency, and announced the contracting of 28 private laboratories that would increase testing capabilities and availability within New York State. In addition, on March 16th and March 14th, New York City Mayor Bill de Blasio, and honestly, if anyone can remember, most of people at the time were talking, oh, don't worry, just the elderly would be affected by the COVID-19 pandemic, and everyone else would be fine by it. It's if you're young and you have a solid immune system, you should be fine. It's just the elderly, the vulnerable population that will be affected by it. And it was kind of this attitude that was shifting the reluctance to close businesses because, businesses are the economy and there is reluctance to close them. But on March 16th, schools were ordered to shut down, and they were ordered to shut down by Governor Cuomo, followed by the March 22nd business closure by a state governor's executive order request. It wasn't the New York City's policy. It was the state ordering them to close businesses and schools and public areas such as parks and recreational areas such as malls. And this was all part of Governor Cuomo's 10-point plan. The 10-point plan was essentially enacted to secure the 6 feet social distancing awareness, non-essential employees being advised to stay home, and social gatherings like entertainment events discouraged, and face mask awareness, but it wasn't mandatory. It was just awareness of face masks. You could still go out and not have a face mask, and many people were doing this. So let's look at the effects of these March policy. Well, the first policy that I want to analyze was on March 11th, and it was regarding the laboratory testing. At the time, there was only 719 tests that had been performed from March 1st to 12th. So testing went from just a few hundred here and there to about 10,000 each day. And even if you ask me, that's kind of low for New York City. A population of New York City is millions, so that 10,000 a day is actually quite low. So they could have done a better job at that. The next policy was a school closures that was enacted on March 16th. At the time when the schools were closed, there were about 620 confirmed cases of COVID-19. But like I said before, the amount of testing was very low, so no one really knows how many real cases were at the time. If you don't get tested, how do you know you have it? And finally, March 22nd, the executive order that closed a lot of businesses and restricted social gathering events was quite effective, in my opinion, but I'm not sure if it was enough. And you'll see this in the graph that I'll show later on. And you can also see that at the end of March, despite all the things that I just said, there was 48,000 confirmed cases of COVID-19 at the end of March, with the first case being on March 1st. So going from 1 to 48,000 in just 1 month is honestly a pretty big failure. Switching to April and May. So April 15th showed an executive order, a governor executive order, requiring that everyone over the age of 2 to wear a face mask. It was the face mask mandate opposed to the awareness that I was speaking about earlier. This required anyone 2 years of age or older, you have to wear a face mask in public areas, if, ands, or buts. April 26th, we had the reopening strategy that was introduced, and it would be phase-based. Some different places in New York opened quicker than New York City, but since the focus of this project is on New York City, we're going to focus on the dates that New York City entered these phases, the first of which would be June 8th, and it eventually did meet that goal. And this other thing, I want to include the May 26th Bill de Blasio approving a financial relief package. I thought this was very interesting because although it's a financial relief package, it aimed to deter people from leaving their homes in search of work. Because when you lock up people for a month, the bills don't stop and rent doesn't stop. I mean, they still have to pay things, and this kind of encouraged people to go out and look for work. So with this financial relief package, I thought it was an excellent idea to keep people at home, and so they wouldn't have to worry about financial burdens, and they could just focus on the health and well-being of the people around them. The effects of these April and May policy. Well, despite the efforts, April saw a pretty big impact. They had about 4,000 new cases per day in New York City. April 14th marked the biggest spike, and you'll see it on the graph. It's about 8,000 people who tested positive in a single day. However, I want to point out that after the April 15th face mask mandate, this level dropped to about 2,000 to 3,000 positive cases per day. Still a lot. I mean, don't get me wrong. There's still a lot of cases. 2,000 to 3,000 still a lot. But it went down, and it was progress towards the right direction. And that's what we're really kind of looking for here. And on May 2nd, New York City would not have positive cases exceeding 2,000. And I want to go over the reopening policy. First, phase 1, which began on June 8th, it was just essential. Businesses were open, retail, grocery stores, things that people actually needed to, stay alive. Some construction sites opened up just to keep things moving, but it was very limited. Phase 2, which was introduced on June 22nd, non-essential businesses were allowed to open up. This included like outdoor restaurants, hair salons, offices. Of course, you needed appointments. And as for offices, despite it allowing people to go to work in offices, a lot of corporations still advocated for work at home, and they continued to do that actually. Phase 3, which began on July 6th, it was mainly focused on gatherings of up to 25 people were permitted, parties and indoor dining for restaurants. And Phase 4 expanded this to 50 people on July 20th. The effects of reopening, well, confirmed cases did not exceed the 600 point from June until present, really. I say present with quotation marks because recently, last week and the week before, cases have been spiking up again, and there hasn't really been much research on that. But you'll see that in the graph that I'll show in a minute here. And testing was ranging from 20,000 to 47,000 tests per day from June 1st onward, with only about 350 positive cases per day on average. And this is the graph, and you can see here this was the I don't want to put the zoom thing there, but as you can see, the yellow shows the confirmed positive cases, as well as the blue showing the amount of people tested. So as you can see, testing was very low in the beginning, low testing capability, and there was a lot of positive cases. But as soon as April hit, and all of these restrictions and face mask mandates hit, you start seeing a decline going into May all the way into June, and you see this nice flat line of cases. However, I want to say that all the way over here on November 1st, there is cases spiking up again. Like I said, we don't really know why, but maybe it has to do with the election, people going out to vote. But there has yet to be research on that. And I just wanted to include some age group demographics, percent positive, and the ethnicity of people who are being affected. As you can see, it's not just elderly; it's just kind of across the board of people being infected with COVID-19. However, at Black and African American and Hispanic are amongst the top ethnicities being affected. And as far as deaths are concerned, 75 and up are the ones dying, the vulnerable population. And these are the pros and cons to summarize. Pros: social distancing mandate, yes. Face mask requirement, not awareness. Business, school, and public area closures, and increased testing capability and availability. Cons: slow policy implementation, reluctance to close businesses by, like I said earlier, politicians didn't want to close anything. And of course, no preset health safeguards against a pandemic. I think there should be a switch that society can take to impose like a kind of a state of emergency, but for pandemics, that would enact all of these in one go instead of gradual figuring out what to do. I think it would save a lot of lives. And now I'm going to pass it on to Kevin for Los Angeles. Kevin, your mic's muted.
Hi, my name is Kevin. I'll be talking about Los Angeles' response to this COVID-19 pandemic. According to the US Census, Los Angeles City has approximately 4 million individuals, and this is the second largest in the state, New York being the first. And as of October 30th, 2020, there were 125,000 COVID-19 cases with 3,000 COVID-19 deaths. The general timeline of how it affected in Los Angeles was that the first case was in January 23rd, 2020, which was 2 months before the declaration of the pandemic. And on March 4th, Mayor Eric Garcetti declared it a local emergency. Even though he declared it a local emergency, between the first case to the declaration of the pandemic, there were no policies put into place to mediate the spread. It was only afterwards it was considered a pandemic that policies were put into place. One of the first policies that were put into place were a set of policies that pretty much locked down Los Angeles City. The first one of the policies banned or prohibited gathering of large groups. The second policies in general help close many non-recreational businesses such as bars, hair salons, barbershops, and indoor dining. And the third one asked individuals or required individuals to stay at home and work at home whenever possible. There was a $1,000 fine for any violators that were caught. Multiple studies found that social distancing does indeed work in locations that implemented them, but because it worked in the places studied doesn't mean it'll work in every place studied. If you look at the data of Los Angeles, you can see that starting from April 1st onwards, there are actually a decrease or a flattening of new case rates. This actually follows one other studies that found that it would take time before the effects of lockdowns could be seen, which is usually between 1 to 4 weeks, which this supports as lockdown policies were implemented around March 19th and April 1st is around 2 weeks after that. One of the pros of the lockdown of Los Angeles was that it was implemented rather quickly ever since the pandemic was issued, which was only like a few days afterwards. Studies found that implementing lockdown policies even a week afterwards could increase the number of cases by up to 10 times. One of the downsides of the lockdown is that if most businesses are closed, many people would not be able to work. The data shows by the Board of Labor found that in April, there was a spike in unemployment going from 4% to almost 16% in Los Angeles. On April 7th, a new policy was put into place that required anyone out in public to wear a face mask. It didn't have to be a surgical face mask. It just had to be something that covered your face. It could have been either a bandana, a scarf, or anything that just, or a homemade one that could cover your face. Businesses were allowed to actually refuse service for people who did not have these face masks on. Studies on face masks and the effect on COVID-19 itself are little to none, as since it's a new virus, but there are studies that show the effectiveness of face masks on respiratory diseases. Because COVID-19 itself is a respiratory disease, there may be an association where face masks could be beneficial. The problem is, looking at the data, face masks seems to not have helped it. Starting looking at April 20th, 2020, you could see that the rate of new cases actually increased after the face mask policies was implemented. There is a note that on April 20 itself, that a mass release of data was released due to a backlog of testing results, but this would only explain a spike in the rate of increase for that one day, and the rate would actually go back to normal if that's the case. But looking at the graph, you could see that the slope of the line changed constantly throughout afterwards. That's indicating that the problem is not just due to the one-day mass release itself. So face masks were shown to work on respiratory diseases. So why did it not work for COVID-19? It could be possible that COVID-19 has something intrinsic in itself that allows face masks not to work, but more studies is needed to be able to determine that. There are also studies that found that for other respiratory diseases, face masks are not effective or actually may worsen the conditions if face masks were worn incorrectly, which could be the case in Los Angeles, where many people are probably wearing them improperly and giving themselves a false sense of security, which can cause an increase in the rates. The next major policies that came into place were the reopenings of the businesses trying to return to the norm and allow businesses and people to be able to work again. On May 29th, these have hair salons and barbershops and indoor dinings were allowed to open, and in June, gyms were allowed to reopen. But looking at the data, you can see this was not actually a good idea. Ever since that, if you notice on June 19th, you could see a big spike in a rate of new cases ever since those policies were allowed to open. Because of that, you could see that the mayor has forced those businesses to reclose to try to stop the mediation of those new cases. Looking at the demographics of the cases, you could see that even though the older population of 65 and older does not have most of the cases, they do have most of the deaths. 74% of all the COVID-19 deaths in Los Angeles was in the elderly 65 and older. And 93% of all the deaths had an underlying disease, such as diabetes or high blood pressure or something else that already affected it. Looking at the gender, males and females were both equally likely to get infected. And if you look at the age population that had most of the infections were between 18 to 50. And any claims that said children did not get infected is false, as there are individuals that are infected that are less than 17 years old that got it, up to 10%. About approximately almost half or more than half of the Hispanic and Latinos were the ones that got the case, but that does not mean there's a problem or a higher chance that they will get infected. It's just that the city population of Los Angeles has mostly Hispanic and Latino populations. Right now, starting in November, there is also another spike in cases, and we do not understand why. It could just be because of what Noor said about voting, but more studies needs to be done about that. In summary, Los Angeles The pros of the policies in Los Angeles were that lockdowns were implemented rather quickly and may have saved many lives. The cons was that face masks, which was supposed to help, actually increase the amount of cases. And another con was that they may have reopened too soon, or their policies to reopen were not strict enough, as that also increased the number of cases. I'm done, and I'll bring it to Houston.
Are you not?
Can I?
Um,
Did it work? Oh, there.
got it.
Hi, my name is Jen May, and I'll be presenting the policies in Houston. Houston is the fourth largest city in USA. Population is about 2.3 million. As of October, there is a total case of 81,756, and total deaths is 1,297. A little bit about the timeline. The first positive case that happened in Houston was in March 5th, and Mayor Turner first declared a local state disaster for the public health emergency. It wasn't actually a actual policy. And on 17th of March, he requested that all bars and nightclubs to close. And then on March 26th, it showed that the first COVID-19 case death in Houston. And then next, we're going to talk about the four main policies responded, and their effectiveness will be assessed individually. The first one was when introducing the free drive-through COVID testings. The first one was in March 21st, where it was only available for any age with chronic illnesses. And then later on April 1st, they introduced a second testing site available to anyone with chronic illnesses. And on April 13th, that's where they were opening up the testing site for everyone without restrictions. And then later on April 27th, where they introduced mobile testings to more vulnerable communities where they were more unable to get tested. So they were bringing the testing to them. Was it effective? Yes, because due to the increase of testing sites, there were more than 500 high-risk symptomatic people were tested in the first 3 days of operations. And by the end of March, you have there was 377 people tested positive. And anyone who tested positive, they can get as soon as possible treatments and also mitigate the spread of the COVID-19 to other people. And also the testing for the vulnerable communities, it helps because then those people can get proper treatment as well. The second policy was implemented was the stay home, work safe order, where Mayor Turner joined Harris County Judge Lina Hidalgo's order, where on the March 24th, and the policy extended to April 30th, where it allows everyone living in Harris County to only leave their residence for essential business or essential activities such as going to see the doctor's appointment or getting groceries. And also they implemented the social distancing, where it requires people to maintain 6 feet of social distancing. And then, was this policy effective? Yes, the early implementation of stay home, work safe mandatory order was very effective with slow the spread, because in March 24th, you see there is a 55 total cases identified. And by the end of March, that's where 377 total cases with only 4 deaths. And from April to May, there was about 3,000 cases increase. with only 60 deaths. The next policy was the mask up and face covering order. And first, Mayor Turner introduced the mask up campaign, where he suggests encourage Houstonians to wear a mask in order to safeguard themselves from potential exposure. And on April 27th, that's where the Harris County Judge Lina Hidalgo enacted the actual face covering order requiring all individuals over the age of 10 to wear a face covering. And later on August 3rd, that's where Mayor Turner started to enforce the wearing face mask. If any violation of wearing a face mask outside of their residence, will have a $250 violation fine. Was this effective? It was undetermined, because if you're looking at the data from May to July, the people who got tested and the positive rate was increasing. However, at that same time in May, that's where the reopening was occurring. So it was undetermined to did face mask order actually effective or not, because it happened almost concurrent with the reopening phase, which I'm going to talk next. The fourth policy was the reopening order, where it was enacted by the Texas Governor Greg Abbott, and Mayor Turner support the reopening order for City of Houston, and it happened phase one on May 1st. With phase one, the order allowed in-store, retail store, services, dine-in, restaurants, and other businesses to open up to 25% of the total occupancy. And then on May 18th, that's where phase two was continued, where restaurants can increase to occupancy of 50%. And then on June 3rd, phase three continued, where restaurants were allowed to reopen indoor dining with occupancy of 75%. However, due to substantial increase of cases during COVID-19 due to reopening phases, Governor Abbott paused the reopening plan and enacted temporary adjustment to reduce the growth of spread of COVID-19 on June 25th. So was it effective? Here is a histogram showing in March and April and May, the total cases were stable between May and April. It was about 3,000. And when you see on June and July, you see the increase was in June itself was 12,000, and July itself it was 26,000. So due to the reopening too soon has caused Houston COVID-19 positive cases to increase very rapidly and yet to be recovered. On this graph, on this histogram, you can see that between the time from June to July, there is about 25% positive rate, which meaning that every 4 people tested, there's 1 person tested positive. So let's talk about the pros and cons of the policy that it was enacted in Houston. The pros was to introducing free drive-through COVID testing available to anyone, and also including the vulnerable communities. The early implementation of stay home and work safe order, and the mask up campaign and face covering was indeterminate because due to it happened together with the reopening. So the data was not supporting or not supporting it. And the cons was the too soon reopening order. And as of today, Harris County, including City of Houston, the threat level of COVID-19 is still at level 1, which is the stay home, and it signifies the severe and uncontrolled level of COVID-19. And the fatality by race and ethnicity, one of the Hispanic and the Black population were mainly affected, while the white was the third race ethnicity that was affected. And most of the deaths that was caused due to the patient had underlying health conditions was the major percentage with 92.2%.
So to conclude, for the future, in case there is another pandemic, once the state, county, and city governments were clearly put on the spot to come up with their own solutions for their own communities, focus was set on creating resources, testing sites, providing healthcare personnel to work, and providing these essential workers with proper PPE, while at the same time encouraging public policies implemented to maintain social distancing, limited gatherings, encourage the use of homemade PPE, and participate in any effort to slow the spread or flatten the curve. Concern was focused on the ability of healthcare institutions and available professionals to provide adequate care with sufficient PPE, medical equipment, and testing capabilities. It fell to the hands of the public to follow public policy created in response to the pandemic to prevent spikes in case numbers that would overwhelm the local healthcare systems. The events that snowballed from the end of 2019 to our current date should provide the examples and learning tools necessary to develop a more effective and prompt response in the face of an inevitable future outbreak of a disease. Despite the origin, lack of specific study, and whatever the political climate is at the time, the response to a threat of human life should be addressed promptly and canvassed across the nation in a way that is organized, equal, and effective, with examples of effective response times and public policy implementation. One ought to learn from the past to become better in the future. This concludes our presentation across New York City, Los Angeles, and Houston. And on to questions. Question 1, what is the purpose of enacting the Defense Production Act by the federal government? The answer is C, to entice manufacturing companies to focus on providing crucial medical supplies as the demand increases across the country.
All right, question 2. Which of the following are considered a con in New York's handling the COVID-19 pandemic? Was it the mask requirements, business closures, no preset health standards against biological pandemics, or contracts with reference laboratories? The con was C. No preset health standards against biological pandemics. They should have been a plan implemented already for a situation like this from occurring, rather than multiple ideas being founded as time went on and cases rose. Question 3. What encompassed the New York 10-point plan in response to the COVID-19 pandemic in March? Was it the mandatory face masks, social distancing, face mask awareness, non-essential employees, advice to stay home, increased testing capability through private laboratory contracting, or the school, business, and public area closures? Well, the 10-point plan was actually B. Social distancing, face mask awareness, non-essential employees, advice to stay home. It was the face mask awareness. It did not include a face mask mandate in the 10-point plan.
Question 4, what is the reason why face masks cannot be effective in decreasing the spread of the virus? This is specifically for in Los Angeles City. Was it because the virus is too small and goes through the mask? Is it because improper usage, reusing mask, or none of the above? The answer is improper usage. Multiple studies have shown that improper usage may actually not cause a decrease, or can actually cause an increase in the rate of cases.
Which of policy showed did not supported effectiveness for Houston, Texas to slow the spread of COVID-19? Was it A, face covering order, reopening order, testing site availability or stay home and work safe order? It was the too soon reopening order which causing Houston, Texas to be still in level 1 severe threat level at today's date.
Well, that concludes our presentation, and these are just some references. Thank you so much for watching and learning, and it was a pleasure to do this research, and it was a pleasure to work with all of you.
Thank you.
Thank you, guys.